Let's go here. All right. All right. All right. We are live with the Crooked Spine Show again. This is my guest, and I hope I pronounced your name right. Njideka Olatunde.
We'll go with that. It's
Okay.
Njideka. We'll go with that.
Njideka. Got it. I practiced, but I'm like, ugh. I won't get it right, hopefully. So you are my first guest about reflexology and touchology. So really, we're going to discuss the power of touch and using that to heal our bodies physically, emotionally, and also psychologically. So if you're a chronic pain sufferer, enjoy the show, listen up, understand to help your body heal properly. And what I talk about is, are you tired of taking medications that are not helping or not effective and that have risky side effects? Nikita is here to help us understand. She's a master in reflexology, leading expert in the transformation practice of reflexology touchology combination. She has empowered thousands to break free from the cycle of pain using the power of touch as a first line approach before medical treatment. Okay, she has trained over 2,500 reflexologists, mentored countless others, and transformed over 3,000 lives through a holistic pain relief practice in DC, Washington, DC. Let's learn today how reflexology, touchology can help you become healthy again without medication use. So take it over. Let me get a quick intro from you, ma'am, and see how things go.
All right. Thank you for having me. I'm enjoying this.
Of course. So how did you get started with everything? How do you start in this whole process of becoming a reflexologist, touchologist?
Okay. Let me see. Let me kind of condense that. What really happened was I grew up dealing with home remedies. That's where everything all started. I grew up, dealing with home remedies and dealing from the standpoint of natural. Believe it or not, back in the day when I was growing up, doctors did home visits. And so I thought the doctors were healers as a child. So one of the things that started was the fact that I wanted to be a doctor. But by the time I got to college, I got a rude awakening that the doctors that I thought were healers was not what I was going to become. So I immediately changed careers and went into social work. But what happened was the fact that being a social worker, the clients that I served, they always went to the emergency room for their doctors. And I said, well, what happened to prevention? And so that sparked, and then the time came when natural therapy was coming into play. So then I went back to school and became a naturopathic practitioner. But while as a practitioner, I was looking at what did I want to specialize in? What did I want to add to my naturopathic practice? And I was connecting, I did what was called an ancestral connection to my cultural connection. And because I have Native Americans, I got to spend some time in the Native American culture, and we did what was called a vision quest. And by doing the vision quest, after it was over with, I was told you need to do something with your hands. So I went back and thought it was going to be massage, but I didn't like massage, but I liked reflexology. And from there, that's how it all evolved, just from dealing with a vision of doing something with the hands and choosing and selecting reflexology.
That's
So
awesome.
that began the journey.
Wow. Isn't it amazing how when you find your strengths and at that point turn into a career where you can help people and be passionate about it, you do that forever, correct?
Most definitely. Um, my life has evolved to so many different arenas just because of reflexology and the power of touch. Because when I started my practice, my very first clients were senior citizens. I built my practice off of senior citizens and then moving into working with their families, and from there evolved a whole lot of other connections. But I say that to say because sitting at the feet of the elders produced a lot of powerful experiences for me personally and professionally.
Is it more of a, if you want to call it, not reinventing the wheel, where getting their experience, their knowledge helps you get to the next level versus having to start over on your own?
Oh, definitely. Because when I started with and Richard, this is how it all
Yeah.
evolved. When I started with seniors, they loved the reflexology, but then they said, "Can you start taking care of my feet?"
Ah.
And I'm saying, okay, that led me to go into the beauty industry. I knew
Mm.
nothing about manicures or pedicures. And so that I took training and did manicures and pedicures. And out of that came the experience where I started my teaching career in reflexology, because I was originally trained in reflexology from a health perspective. I did
Got
not
it.
know
Got it.
anything about the beauty industry, but
Wow.
that came because of me working on seniors. And so that led me to teaching.
It's amazing when you learn something that can teach somebody. It almost like you relearn it in a better way,
Yes,
and it continues to evolve over time, where you're able to communicate it. I call it smoother versus doctor to doctor versus
exactly.
book knowledge per se. Is that
Yes,
same with you?
exactly. That's what it's just. That's the beauty of dealing with the hands on. So when you're
Hmm.
dealing with the hands on, that's that connection between you and your client patient in terms of working, because it's very important. Because I see the work that we do, we are what I call assisting the body in the healing process. We are the body's assistants. And so by doing this, there has to be a connection in order for it to work between you and the clients that you're working on. And when you get that connection, then the body does what it has to do with you working with it, assisting it to get better.
It's almost, as a chiropractor, we talk about self healing. We talk
Yes,
about certain things philosophy wise, but the touch is so important to understand how to do it properly and safely, so you get that benefit. I want to call it energy wise, but also releasing the energy of the body to work its potential versus when it's stuck where it can't get the potential.
exactly. And that's the one of the things, in terms of me getting started,
Hmm.
one of the things that really happened, I had to realize that there is no one modality that can do it all. You
No.
have to have an integration. And
Hmm.
that's how I put together what I call the touchology wellness experience, because it's about, we use reflexology first to relieve pain before treatment. Then we look at how do we integrate other hands-on healing practices to relieve the symptoms. So that way you bring the integration in terms of where you have a, an approach that deals with all aspects, mentally, physically, and emotionally. But I still believe, from the standpoint, it has to be a touching therapy that does the job.
And when you talk about your process and touch, I'll just jump. I have a bunch of questions, but I'm going to focus on what we're
Hmm.
focused on right now. Is how would you explain? You mentioned touchology is a combination of reflexology plus other therapies. What are those therapies? What are those other variables? I want to say therapies per person may be different, but what do you offer as options for therapies, or do you refer out, or how do you work that?
Okay, what we do is, when we talk about therapies, it is basically a refer out,
Okay.
because what I do is, in my practice, I put together what's called a an assessment evaluation. And the
Okay.
assessment evaluation is a combination of the information that I get from my clients in terms of why they're in pain and what's going on with the body. And then I put together what's called a treatment program, dealing with what integrative therapies will be best in terms of alleviating the symptoms that has caused the pain. So, I mean, like we may say, for example, if somebody came in with a back problem, and after I've worked on, like, relieving the pain related to the back problem, I may say you may need to look at, there's a structural problem going on. So then a chiropractor would be who we would refer to, because now we're looking at musculoskeletal problems that can be addressed through chiropractic care. Or it may be we're looking at, there's some vitamin and mineral deficiencies. So then we'll have to look at, you need to be able to go to a nutritionist who focuses on the natural approaches to meals and planning. So like it's a combination where we're looking at the whole body in terms of what it specifically needs and what particular modality addresses that. So we put a comprehensive. And let me share with you how that happened. I had a real unusual experience. I got to represent America at a health conference in Cuba.
Ooh, wow.
And while I was there, what was really fascinating was they have what you call, it's the cultural connection, which means they bring together all of these practitioners. We're talking about for one person, in terms of whether it's a nutritionist, whether it's a chiropractor, whether it's a acupuncturist, a naturopathic. They bring all of these people in. We're all there at one time. And you have the naturopath who is directing which practitioner should be doing what particular thing at a time. And that is a marvelous and miraculous healing experience that a patient can go through, because now all areas are being covered related to that particular health issue. And that's something that we have not understood how to do in terms of when you talk about integrative approaches to therapy. It's not about my modality is better than your modality.
No.
And I can only do this. It's not about, if you all are working together, then you have a comprehensive approach that leads people to do one thing: put the heel back in healthy.
Good. And I like that, because a naturopath that I mentioned too, you'd mentioned, we're in the same page, we have a very similar philosophy. The body is self-healing. So having that initial portal of entry perspective, now we're going to go down paths of natural medicine, chiropractic, maybe physical therapy, maybe massage, maybe exercise, maybe nutrition for one too, healing the body, versus going the medical route where what are we going to take out of the body? What are we going to medicate the body with? So you're going down more of a natural route, which obviously has less side effects. Doesn't make pharmaceutical companies money, for one, but allows people to actually get better healthy wise and hopefully stay healthy, correct?
Definitely, because the thing that we do, because we're hands-on, people don't understand the positiveness that's connected with the power of touch. The power of touch, since the beginning of time, has been the foundation for all healing. Even if you go get a salve and put a salve on your body, you still have to touch. And so when you understand the power of touch and what it does in assisting the body in the healing process, pharmaceuticals cannot bottle that.
It's almost the opposite, correct? I mean, if someone's seeing their medical doctor, it usually is hands off. They may touch your back if you have a back pain or neck pain, but it's really not getting in there and seeing what's going on and moving the joints and feeling the person, and also seeing their reaction to your touch over and over again. It makes you an expert over time. As you see people, you've seen thousands of people, to help them, and using that experience from those thousands of people for the next person. You're seeing a lot of that, not only in their reaction, but also their history and where they are right now. I think that's our separation as natural healers versus someone who's going to sit there with a prescription pad and goes, just try this on you now, even though it has side effects. Let's see if it helps you or hurts you.
That's a good point, because when you think about it, when a person goes to the doctor, they're going to the doctor for one thing. I'm in pain. Okay, so I go into the doctor and I'm in pain. What's important to that person who's in pain? They only want one thing:
remove the pain.
Relief from pain. But when you go to a doctor's office and you're in pain, the first thing that's done is, well, I need to do some tests to find out what's going on. Then I do the test. But before I do the test, I give you a prescription to do this. You haven't even connected with the person to really find out what's going on. And so we talk about touch. Just spending a few minutes to listen is touch. Just to hear your client or your patient tell you what they're feeling, tell you what's going on. And from there, you can now put together, oh, now I know what I need to do because I heard you. And just by you listening, laid the first step toward the healing process in terms of them being able to work with you with whatever your modality is as a treatment. They'll work with you because you just did the one touch thing: listen.
It's almost you listen, but also help them, in addition, explain where the pain's coming from, possibly.
Yes.
Then the modality or assessment or testing or imaging or even blood work will verify that. Then you have really a reason why you're in pain, not just go cover up some medication and hope it goes away.
Exactly. Which, and that's all a patient and client wants is listen to me, to what's going on. I have so many clients come to me talking about, nobody listened to me. I know I have this pain, and they're going to tell me it's this, it's that. But the fact of the matter is, by not listening, you don't even get an accurate assessment of what's going on just because you didn't listen. And we know that, they have a schedule in terms of, I got to see so many patients within such a certain amount of time. Because I also had the opportunity to study in China. And in China,
wow,
they may spend anywhere between an hour to an hour and a half or 2 hours.
Wow.
Just talking. And then when they do that, they are looking at, if a patient comes in with a problem, they're looking at, how do we resolve this health problem so that it now becomes a prevention for the whole family. And I really was impressed with that, because before I left to go to China, I had wrote my book, which is Reflexology Today. That was the first book I wrote, Reflexology Today, A Family Affair. That was the first edition. But I wrote that specifically because I believe that families should be a part of the healing process. And that, when I got to China, that became a confirmation, because if a family member comes in with a health problem, they're saying, okay, how do we help this patient so that the family will be able to receive the benefits from a preventive approach to prevent this from happening. And remember now, we used to talk about prevention here, but that's a word that nobody even says anymore. Where is the preventive approach to health?
And that, even like you said, mentioned earlier too, with COVID, I mean, it made it almost, as a natural healer, easier for people to gravitate toward, because they couldn't even see their doctor. They had no choice but to see us because we were more available, I think.
And the other thing, this is my unscientific study about the COVID. And that is the number one reason most of the people made transition during that experience was because of lack of touch. And touch took more people out. I mean, non-touch took more people out, because the fact of the matter, I couldn't even see my family. I'm in pain. Nobody can touch me. Nobody. That was very crucial. And I don't know how many people, look to understand the importance of touch in the healing. That revealed it. That was so crucial in terms of what we do as hands-on healers by touching our clients and our patients. And that was a big problem with the going through that pandemic. That's my scientific study.
It's almost, if for example, in prison, right? I've never been in prison yet, as far as I know. But why is isolation such a bad thing in prison?
Here we go again. If you can't talk to anybody, talking is touch. The power of the word is touch. I mean, the fact of the matter, I know because you're young, but in the old days, our parents used to have a thing. If you were doing something wrong,
oh yeah,
they had what was called the look, and you knew when you got the look that you had did something wrong, and you had better straighten up immediately. That's a touch. That's a form of touching, and so touch is so powerful. It's not just like when you do hands-on. Just to be able to in your car driving and somebody lets you in and you raise your hand up as a form of saying thank you, that's a form of touch. It's that's how we survive, that's how we function through and touch was what our first line of communication. When you were born what? Receiving a touch. You come here with a touch.
It's the I want to call it not adrenaline, but an endorphin type of release naturally by having that ability to touch someone or be touched by somebody in any sense possible, correct?
Exactly, because the endorphins is what? The body's natural pain reliever. And if you can activate the body's natural pain reliever, now you're moving in direction of assisting the body to do what it needs to do to correct itself in the healing process.
It's amazing when people understand that, when you can get your body, and again, same thing, reverse, right? Reverse. If you've been isolated, if you've been chronically sick for a long time and you've been away from touch, that point your body then goes into a sickness, a quality of life sickness to where it's hard to get out of also. So it may take your body time to get several treatments of touch, of communication, of therapy, of chiropractic, of neuropathy, of reflexology, get your body to now reset itself to now a better default over time to get yourself there and keep you there, correct?
Exactly. And it's about, that's where I say we assist the body in the healing process, because now you're educating them on understanding that you have the mechanisms inside of you to heal yourself. We just have to work with activating it so that the healing process can begin. And that's the beauty of it. And I've seen it in so many different modalities in terms of practitioners who touch and have turned people's lives around. And one of the things I can share with you as it relates to reflexology, this is an experience that it's very touching to me. I had a client and she was a senior. And every time she came to me, she brought her granddaughter. Her granddaughter was about 12 years old.
Okay.
And one day her pressure went up real high.
Her blood pressure.
Her blood pressure went up. It was real high. And her granddaughter grabbed her hands and started rubbing on her hands and rubbing on her feet. And her pressure went down. But it came from the fact that her granddaughter had seen what I was doing to her grandmother and tried to do the same thing, which led me, here's another thing from the seniors, which led me to putting together a training program for young people between the ages of 16 to 18, teaching them how to do reflexology. And I did that from the standpoint because there was a time when young people were going through a lot of stress.
Mhm.
And as adults, we know how to do, we can go to get a massage, we can go but nobody was telling young people what you can do to relieve stress. And that's how introducing them to reflexology became a stress relief tool for them, in terms of, instead of getting angry, we used to play games. Instead of getting angry, grab somebody's hand, start shaking their hands, and see does that calm down. And so these are the things that we're talking about, because young people today are the population that receives no form of touch. And they are struggling because that's the one thing that they want.
It's almost, and we both know this, we're on the same page, is how has phones, computers, gaming
Yes.
for one too, say in someone's bedroom or someone's on their own for one too, how's it had helped develop our use of brains in a good state or a bad state, or how would you explain that?
I would say it's limiting us. And I say from the standpoint, number one, and this is something that you can understand.
Mm-hmm.
If you're on that computer, now you've lost dexterity in your hands. I find so many young people that can't write.
Mm-hmm.
That all because, like, the problems that they have working on the computer, so they don't have dexterity.
Mm-hmm.
The fact that young people now don't even know how to interact with each other face to face, because I got to see you FaceTime on a machine, even if I do that. Or the fact of the matter, I don't want to talk to you on the phone. Let me just send you a message here. There's no form of interaction. And that's not healthy. It's not healthy at all.
It's a learned skill that if you don't practice it or learn it at a young age, it's hard to gain later on, I think.
Mm-hmm.
And I think, I mean, like I said, I'm not ancient. I went to school and we had to speak in front of a class, talk to
Right.
people in a classroom. We had to be social in those atmospheres. Obviously, do things like that, even dance for one too, that allows you to interact with people on a daily basis in a classroom setting. But with COVID, with everything going on, you can now interact, I guess, through computer, like you said, through text. Also, we had to call somebody back then.
And,
You had to go and meet somebody, you
yes.
know, things like that. You had to actually interact with people. I have interns in my office now that come to my office. The first thing I learned with them and work with them is number one weakness is communication.
Yes.
Look in someone's eye, shake their hand properly,
Yes.
ask the right questions, speak in a certain tone of voice for one also. These
Mm-hmm.
are skills that even as chiropractors, even in practitioners in general, I think you medical doctors too suffer from the same thing. They don't train those skills in school. They train to pass the boards, to get them out of school into
Bottom
practice.
line.
So how do you get someone who's a bookworm, a book knowledge, who doesn't have that diversity of a skill set to learn how to touch somebody through their language, through their body language, through their physical touch, through their eye contact, anything they can do to understand someone's concern, their medical history, medical problems, to get them the right care. I think that art has been lost. That
Oh,
bedside manner, as
I
you want to
agree
call it.
with you 100%, because it's an art.
Yep. Mhm.
Listening is an art. And what people don't understand, believe it or not, healers, practitioners back in the original time were known as artists. You were called a healing artist. And as a healing artist means that you are doing your you're using your creative ability that comes from within and manifested on the out. And that's why hands-on healing is so powerful, because everybody has their own unique ability of touch. Every
Mhm.
chiropractor is not the same.
Mhm.
You all learn the same skills, but your touch is different. When I'm teaching reflexology, what I tell students is that I'm going to give you the basic fundamentals, but it is for you to put your creative ability into the fundamentals with everybody you're working on, because that's where the healing begins. It's not being a replica of what I teach. It's being an exact example of the artistic healing ability that comes from within that you pass on.
It's almost, you have to be very genuine about it, especially when someone's hands-on.
Yes.
People are going to know if you're being genuine or non-genuine. Are you being a robot, or someone who actually cares about you as a patient, as a person?
You are so right, because that's where the connection comes in. Because I may not be the reflexologist for this person, but there's somebody else who is. And it had nothing to do with me not being a good reflexologist. It's just, I am not the one.
You
My
have to have that
energy
connection with the
does not
person.
connect with you.
If it's not, it's not going to be. It may be 80% helpful, but not 100% helpful.
Exactly. That's why I tell her, I said, I tell all of my, when you take my training program, the day that they complete the program, I said, now you all are my colleagues. You're no longer my students, you're my colleagues. And I want you to understand that there's enough feet and hands out there for everybody. We do not have any competition. There's enough for everybody. And don't have that kind of mindset that we're in competition. We aren't. We're all.
The competition people have is really with themselves.
Yes.
Of staying passionate in their field.
There you go. Because one of the things in terms of me practicing reflexology, when I went to China, one of the things in China about disciplines is that you become a master of your art, which means you devote specifically. And for me, when I got into reflexology, that's all I do. I focus on reflexology. I don't do anything else. And that's what I got from being in China in terms of the importance of mastering your art. I'm continuously learning. I'm continuously in training because of the fact that to perfect this, to get it to where it actually should be, for me to be the assistant in the healing process. That's what's important.
It's something to when we are humble enough to realize, I'm not going to ever know everything, but what can I learn today, tomorrow, from the next doctor, from the next reflexologist, from the next person, even someone who's younger than me, but may have a different skill set. What can I pick up to help my next patient?
Exactly. And that's how you evolve. And you evolve from the standpoint of really connecting with your healing art. You become one with it. And that's also important. Being in oneness with your modality is very important, because the fact of the matter is the end result is, for me, with my clients, the end result is always going to be that you receive some techniques that you can use in relieving pain that allows you to take back control of your life from pain, so that you now are able to function in a means of having prevent it, and be able to know how to be connected to preventive health.
When you have that, it's almost you stay passionate in that field to where you want to help the next person. You want to help the next person. Not worry about everything else there. Everything else will come into play. But like you mentioned before too, being a master of your art versus jack of all trades lets you focus on just one thing. People come in your office, they know you're a reflexologist. They know I'm a chiropractor. That's all I do. I don't sell vitamins. I don't sell pillows. I don't do any modalities. I just do chiropractic hands-on. That's all I do.
And that's what establishes you in terms of why your clients and why your patients come to you, because I know I'm going to get what it is I need based upon the modality that I am receiving. And that's what's crucial. And I always tell, because people used to ask me all the time, as in terms of, do you pick up the energy of the people that you're involved? And I tell them, no, I never have. I said, let me tell you, the key to that is when a person comes to me, first of all, I don't see them as ill. I see them healthy and well. And so by me seeing them healthy and well, that's the goal that I'm working toward. I don't see your illness. Like, you can talk to me all about it, but we're going to work on how to get you to the other side. And my job is to assist you in getting to the other side of being well. So no, when you come in, no, I don't see, because see, that's another thing. And there was a study that was done specifically when it relates to cancer.
Okay.
You go to the doctor and you didn't got all the tests coming back. And the first thing the doctor tells you, well, we found that you got cancer and we need to do such and such. What happens? Because of our understanding of what cancer is, now I'm on death row. And that's what they think. And what to happen? Now we're talking about the pain stress connection, because what have you done? You have internalized what was told to you on the outside, brought it in, and now it's manifested. Because here we go again, the power of communicate, the touch. That word, cancer, was said to you, but it wasn't said to you in a way for you to understand this is a symptom that we need to work on, not you got cancer. And I'm going to translate it to mean something else.
It's almost like it's very powerful in a positive or negative way. Depends how it's presented and how it's communicated, correct?
Yes, exactly. It's the power of the word. And we've got, and as practitioners, we need to be very careful in terms of what we say to our patients and clients as we're relating to putting together their healing program. It's how we talk to them. And the fact of the matter, because I have a lot of reflexologists who they get real happy when they're working on somebody's hands and feet, and they'll say, "Oh, I felt this lump right here in the back area of the nerve ending on your foot," and so you got this nerve problem. No, you don't say that. I mean, in terms of, if that was not a problem for them, now you gave them a problem. And that's not good.
No. It's
but
almost
the fact of the matter is, I want to be the healer that found something. So this is it.
It's almost like you got to read the room first before I say so. I was just myself. Before I say something, if I say this, how will the patient react?
Exactly.
Is it going to help the person feel less anxious or more anxious by my, if you want to call it my phrase or whatever I'm going to say?
That's so important. I mean, it's little small things that are important, because it's the little small things that help things not become devastating for a client or patient that you're working with. You have to be, that goes back to the power of listening. And if you're listening, that means that you have some compassion. You've got to be a compassionate healthcare provider. You have to have that. If you don't have that, you're in trouble.
It's almost like, again, that power thing of, you can be, if you're not compassionate, then your patients leave with a bad perception of what your healing art actually does.
There you go. That's it.
That's what I get. People understand reflexology, touch, but I had a bad massage. I saw this person who did it. I didn't like him. So now that field in my head is not where I want to go.
And I get that all the time, in terms of, well, I had a bad experience with this and I had bad experience with that. And what I tell them is that, one apple doesn't spoil the whole cart. So you have to be open-minded in terms of understanding. That's the reason why when I decided to go virtual, what I do now is I involve my patients and their families in learning the reflexology techniques that they can do themselves as a self-help approach to
Perfect.
relieving pain using reflex. So now you have a better understanding of what it is and how it works. And everybody in the family now has a vested interest in this. And so that's how I'm doing to change that whole dynamics and getting people to take back control as it relates to them being a part of assisting in the healing process for their loved ones, families, and friends.
It's almost that's the next level of
Mm-hmm.
teaching the next person versus worrying about just one patient at a time or one person at a time. That's phenomenal.
Mm-hmm. Mm-hmm. It's and that's the reason why I say once we get that started, and when we start it like that, now we can move to okay, you have a way now that you can relieve pain without medication and the side effects that go along with it. The next step is what's going to be our treatment plan as it relates to the symptoms that cause the pain. And this is where we come in and looking at the other integrative therapies. So now you have a whole natural treatment plan in place, but you now know how you can relieve pain whenever pain flares up. But now you have the practitioner who's going to work on that area specifically that's causing the pain.
You're almost making the person become their best doctor per se for themselves, where they can now become cumulative to understand this is how it's going to help me. When I feel this, I'm going to start doing this to help treat my symptoms so I can get more help over time, not rely on just the next pill.
Exactly. That's the whole approach. I know Big Pharma doesn't like that, but that's
Sorry.
the whole approach. In turn, that's something that can't be bottled. Because the other thing that's real important about that is it's cultural. Touch is cultural, and all families have cultural healing practices. And by me showing you how to do the reflexology, it can take back to your grandmother or your grandfather talking about, when I was growing up, we used to do this, we used to do that, getting you back. So now we're having a line of communication in terms of what we all did to heal ourselves because it was a natural approach.
It's amazing when people are in the same like a mindset for one too. Why do people, if you want to call it, not stick to your programs, your assessment? Mine same thing too. Mine is where they're not, I guess you want to call it, put in the work. They just want the quick fix. Is that usually the reason?
Oh, basically it's a quick fix because that's the kind of society we live in, But when you start talking about quick fix, for me, you're only talking about something that's temporary. It's not a let, because you're going to be right back at it again. In other words, you know what they say, you keep doing the same thing over and over and over again, expecting different results. It's insane, because that's what it is when you start talking about the quick fix. Because with the quick fix, you also pay another price, because after a time, the body is going to start rejecting the quick fix. And when the body rejects the quick fix, that means the area that you were using the quick fix for is now in a state of deterioration, creating something else, which is another problem. Because remember, the quick fix always leads to another problem. It doesn't solve the one that you're using it for. It moves you to a new problem to add to the one you were trying to solve.
So in a worse condition for one too. It's like someone who didn't need back surgery 5 years ago because the medication helped them feel no pain until their arthritis got worse, worse, and worse. And all of a sudden, nope, now you're due.
Yep. That's the scenario. And understanding that, okay, let me be nice, but understanding that you are being used as a tool. Your health is being used. Your pain and your suffering is being used as a means of economics at the expense of your pain. And that's not good. And you have to understand it, because you think about it. Whenever you are given a prescription, you got all these they even tell you what the side effects are.
Mm-hmm.
You got a whole list of all these. So why would anybody in their right mind want to take something that's going to add to the problems that this particular substance is supposed to alleviate for me?
And we both know this, the doctor giving the medication is usually saying, well, don't worry about those. Worry about those later. Let's worry about your pain right now. Let's worry about what's going on right now. You can deal with those problems later. If it doesn't work, we'll give you another pill down the line. We'll do something else. Give you a pill for the diarrhea it gives you. We'll give you a pill for the anxiety it gives you. And add on and on and on.
That the whole 9 yards. And that became real clear to me, because what folks don't realize, specifically in the African American community, one of the things that's real crucial is the number one illness is hypertension.
Mm-hmm.
That's no one. But when you get that first diagnosis of hypertension and you start taking that medication, you have just signed a prescription for life, because you're on the hypertension medication for life. Then your next medication becomes diabetes, because that's the next illness that follows behind hypertension. And that's a pattern. And that is crucial. When you start looking at that, that's real serious.
It's almost like there's not a sense of hypertension. Here's your drug for hypertension. Let's not find out the cause of hypertension, change your lifestyle. It's almost like there's no step backwards, all the step forward for one in my head.
The thing about, and especially hypertension, when you talk about hypertension, what you're really talking about is the stress in your life. And if you're not addressing the stress in your life, you've now internalized it to be, so it manifests and become what's diagnosed as hypertension. But if you deal with the stress, because one of the things I do with my clients is, especially those who've been in pain for a long time,
Chronic.
one question I ask them: when was the last time that you were not in pain? Do you know most people can't even remember when was the last time they were not in pain? And I tell them, I said, if you can go back to when was the last time you were in pain, you will realize that there was a situation that was going on in your life that you internalized. And because you internalized, it manifested to becoming and turned itself into a health problem. And that's real crucial, because pain does not start all of a sudden. It's been building up. It's giving you warning signs. When it gets crucial, it's telling you that you need to slow down and start dealing with this, because the next step is going to be something else that you don't want to deal with. The body's automatically telling you that. But that's what's important when it goes back to listening to your body and being in connection with it.
It's almost teaching your clients, your patients, how to do that also, right? How to read your body, how to learn to read your body. So this symptom is really not the main cause. It's coming from somewhere else.
Yes.
Okay, what is that? Then you've now taught them to really understand that they can learn that. You don't have to go to school, you don't have to go everything else, just learn it.
Right.
How do you feel? What's going on? How do you connect that to a different, like I said, an event, a situation, financial, physical, mental, whatever it might be that may have affected you. Now, how do we change that so you don't go into PST mode every time it happens to you? That habit, what habit can you change so now that doesn't become a stressor for you?
Exactly. It's very basic. We have just made stuff so complicated. Like when we look at our lives, it's like, it can't be easy. Oh no, that's too easy. I can't relate to it. It's a lot more to it. Like I tell people, I said, okay, you turn on your light switch, but you don't ask how the wires connect to everything in order to get lights to work. But just to be about something as simple as stop thinking about that thing that you got staying on your mind day in and day out. Let it go. Go outside, get some fresh air. Like let's start drinking a little bit more water so that like we can start fleshing the body, something basic.
It almost takes someone like a little bit of time, sometimes weeks, a little bit longer, to learn those links of, I feel that I got to go for a walk. I have to watch my diet. I have to watch how much I'm sleeping right now to get enough sleep for one. Also, watch what I'm watching, good or
Yes.
bad. What's
Yes.
helping my mindset stay in
Right.
a positive mood or a negative mood.
Exactly. Exactly. It's a whole. It's a whole. What I call it's a self-help
Hmm.
lifestyle change,
Hmm.
and do it in bits and pieces. We didn't say you got to drop everything all the way. Just find
No.
one little thing that you can add each day that's a little different, that makes you feel good. And, like I said, when is the last time you had a good laugh? I mean, can't you find something? Laughing is healing. Those are, in terms of, I always, especially my adult clients, I tell them, we have put, as you become an adult, you put yourself in a big box. And when you put yourself in the box, you lock yourself away from a lot of things. I say, when is the last time you ever let the little girl or little boy inside of you come out and play? When have you ever had a silly day where you just was actually being silly? It's all right. There's nothing wrong. Yes, you're an adult and you have a right to be
Hmm.
silly. You have a right to play. You have a right to have fun. It's
Right.
not about like, I've got to be structured all the time.
Yeah.
That's a real dilemma for us health wise as well.
Well, sometimes our people around us, our family members especially, or even our work environment doesn't allow it to happen. So we think that's a normal. We're almost, we think we're abnormal because you can't handle that stress. You can't be that way. That's not a standard society thing for one to. But when you believe that that can happen, you go, okay, I'm going to stay away. I'm going to go away from the normal society view of thinking. Now help my body heal and keep it this way. I may not be the average person. I tell people you're the above average person when you can get to that level of thinking and acting. And I tell my patients too, only watch funny movies.
Right.
Just keep your life very simple. Enjoy it. Smile at people. That point,
Yes.
you'll change your attitude, your psychology, your physiology to get to that
Yes.
higher state of health, and you can maintain it there a lot easier.
Oh, definitely. And that's a real big problem in terms of we've now given society control of your life when you don't have to, because you are society.
Hmm.
You can
Hmm.
decide. And that's what you have to deal with in terms of, and I share this because I do a program with the school system in terms of helping children relieve stress. I do it
Wow,
inside the
great.
school system. And it's not the children that the problem, it's the
Uh,
adults who are overseeing the children who are the problem, because they're all so tight and rigid and structured. And because they're tight, rigid, and structured, they get so easily upset with
ah,
children not following the structured norm that they created. And I'm always telling them, these are children. Children, this is what children do. And you have to understand that. And when I work with the children, everybody says, "How you don't have you? How come you don't have no problems?" But I said, because number one, they are human beings that want to be listened to like everybody else. And because I take the time to listen, not saying I got to agree with you,
yeah.
but I'm listening to you, and then we can talk about it. That's and just to have somebody to talk to them, they find that to be totally strange because nobody ever talks to children.
Well, they talk to them, but not with them,
Right,
which is
right.
again, it's and then understand how they grow up too. You're trying to get that seed right the first time, so you don't have to fix it later down the line.
Exactly.
Huh.
Exactly. And so I always tell parents, I say, if I were you, I would go spend a day inside the classroom and watch, see how your children, see what goes on. So, because you have no idea.
Hmm.
You
Hmm.
have no idea, but you need to spend some time. And do you know that that will be something that will be so touching and rewarding to every child if a parent just stopped in there and say, well, I just came to see how school's going today.
Yeah.
Just a few minutes to come in. That would be so enriching for a child just to see that, because that right there is a communication piece that says, I care.
Mm-hmm. It's amazing as any age
Yes,
enjoys being able to be cared for and listened to and taken as a way to be very personable, and at that point enjoying just being for one.
exactly. Because when we talk about the pain that children are going through, it's dealing with the fact that nobody is touching them in any kind of way. And that's where the problem is. And you're not going to be able to turn any of this around until you recognize that a child is a child, whether you like it or not, and let them be able to be children and grow up to become an adult, but let them become an adult that's happy and healthy.
It knows how to have fun. That's all it is, right?
Yes.
Gotta have
Yes.
fun. And as we wrap up too, Dita, how do you want to tell my audience what is the number one message, I guess, per se, to help them heal themselves?
The number one message I would share with your audience is to, first of all, wake up every morning saying the two most powerful words that you can say. Thank you. Thank you is a powerful word. And to wake up every morning saying thank you will lay the foundation for a marvelous day, because it's going to be given to you just because you gave thanks. And the next thing I would tell people is to love yourself. Find a way to fall in love with yourself and look out for you. Take time out for you. Put some time when you're putting your calendar together for the week or something. Make sure that there's a time in there that says, this is my time and I'm not giving it up for nobody.
Perfect.
That lays the foundation for being healthy when you look out for you and yourself. So that's what I would share in terms of being thankful, loving yourself, and my thing I call being selfish and having what I call selfish time. And there's nothing wrong with being selfish because you're taking care of yourself.
You have to be healthy first, physically, mentally, socially, whatever it might be. Then you can help other people, right? Then you can do your normal day. Then you can handle the stress of your day, which will come at you, whatever's going to come at you, because now
Exactly.
you've already taken care of yourself first.
And another thing, um, in the African cultural tradition, when you visit a person's home for the first time, you always bring a gift. And I'm visiting your home for the first time. And the gift that I have for your audience is medication and addiction free pain stress relief poster that they can
Oh,
download.
nice.
And all they have to do is go to Touchology, Reflexology.com. And that is my gift to your listening audience.
I'll get that link from you too on
Yes.
the email per se. Okay.
Yes.
Okay. Perfect. Perfect. Well, thank you for being my guest. We did a little bit longer. Hopefully, didn't cut it too much of your personal time for one also. But I appreciate you being on my show, helping me understand that healing can be natural if you give it a chance and do it before it becomes a desperation, before it becomes more of you have to seek medical care. Doing it now in a healthier state, even if you feel good, why not start some good habits and learn some good things? Your body can stay healthy for a long, long time.
Most definitely, in terms of, and I thank you for this opportunity. I have enjoyed, and to your listening audience, like you, the thing is, it's about healing mind, body, spirit, and emotions, and you have the power to do it. Thank you.
You're welcome. We have all the links for your website, your Facebook, your Instagram, LinkedIn, your Twitter, and also your book and your podcast, which is phenomenal podcast, on the show notes also. So go to her links, get yourself healthy, keep yourself healthy, learn how to do it naturally through my guest today. All right. I'll end the show right now. And thanks for watching, guys. And hold on for 1 second. All right.